Hi, Elise Keller here with Rise, Thrive, Soar and Rise Canna Coaching. I'm going to talk to you today about what I've done, how I've used cannabis during my treatment, and how I'm using it now. As always, this does not replace any of the advice or recommendations of your doctor, your primary care physician. This is just for educational purposes to let you know what has worked for me and what hasn't worked for me, because you can also learn a lot from other people's mistakes. So let's get into it. So I grew my own cannabis. So I was fortunate enough, I was able to make my own full extract cannabis oil. It tested at about a 1-to-1 ratio of THC to CBD. And then I also supplement with a high potency CBD full plant extract oil. Now, I want to let you know I am hormone sensitive, ER/PR positive, as well as HER2 positive. If you are in a different subtype of breast cancer, it is important to know. I did a video all around estrogen and THC, and there's a bit of information there on sort of what to expect, how to be cautious if you are hormone sensitive, a hormone sensitive breast cancer patient. So keep all of that in mind as I go through what I'm doing. You might be doing a different dose, but the way that I'm using the cannabis is something that everyone can use. So microdosing, that's the first thing that I learned. And I learned that the hard way. This is one of the things that you don't necessarily want to do. So I was originally using really high heroic doses, Rick Simpson protocol, starting with that grain of rice and working my way up. And I was feeling very anxious, very jittery, heart palpitations. And I actually think that the pain was heightened. And that does make sense now that I know what I know based on how cannabis kind of acts on in a bell-shaped curve. And we talk about that in other videos as well. But I remember my very first chemo treatment. I was terrified, and it wasn't just because it was my first treatment. My mind was all over the place. It was the THC was far too psychoactive. My heart was racing. I did not feel good at all. I do not recommend, for most people, there are exceptions to every rule, a high dose therapy like that. For curative intent, and if you're being followed by a practitioner that knows what they're doing, that's another story. But as a general rule, when you're looking to use cannabis alongside your conventional therapy, high doses are just not necessary. So what I did learn is that microdoses are the way to go. So I started doing very small amounts throughout the day, and it was higher when I was going through treatment, probably about 10 milligrams of each THC and CBD throughout the day. Every 3 to 4 hours. But now that I am through my treatment, what I'm doing is just about 2.5 to 3 milligrams with my 1-to-1 oil. So that works out to about 2.5 to 3 milligrams of each THC and CBD 3 or 4 times a day. Now, I used to use this little dropper, and that was fine. But what I've since discovered is this wonderful little, I can't remember what they call it on Amazon. It's a atomizer. It's basically a little portable perfume bottle. You can fill it up and you can just spray it right under your tongue. I've measured this, and so I do know that it measures out to the volume of sprays that I get, and 3 sprays measures out for me to about 2.5 to 3 milligrams of each THC and CBD. That's an amount for me that does not cause psychoactivity, but that does help quite a bit with any of the side effects that I'm getting from my current treatment. Everyone's going to be different. And I've done a video on that, on finding your ideal therapeutic dose. And I encourage you to watch that, because you can use all of these strategies, but using your ideal dose. So microdosing is secret number 1. It's a game changer. And if you can get these little guys, I highly recommend them. They're really good for discrete dosing and accurate dosing. Number 2, I used this quite a bit during my treatment. This is a vaporizer. So in addition to the oils that I was using, whenever I had, so oils will take usually about 30 minutes to 2 hours to start working. You're using that sublingually or internally, whereas using a vaporizer is going to get you that immediate relief. So if I had really intense bone and joint pain, that was really common for me, and a lot of nausea. Whenever that was a sudden onset issue, if I reached my vaporizer, that tended to fix my problems. So I would just take a very small amount. Vaporizing over smoking a joint is the way to go if you are able to do that. The reason for that is that it's heating the cannabis to a lower temperature. So you still have the terpenes that are not necessarily all going to be heated away. And it's better for your lungs. So when you're smoking a joint, that's a really high temperature combustion. This is a lower temperature. It's much more gentle on your lungs. So overall, if you're going to choose between vaporizing and smoking, I always recommend getting this vaporizer. Maybe not this exact vaporizer, but a vaporizer. And finally, this lotion salve that I made. It's a really, really simple recipe. I can post another video on that. It's just infused coconut oil. So the dry flower infused into coconut oil with some emu oil as well. It's a great all-purpose topical. So I use this on my incision sites after surgery. I also use this currently as a lubricant. So I was put into menopause as part of my post-treatment, and it's caused a lot of vaginal dryness. And there are a lot of women out there who have the same issue, especially young women who are put into menopause, or women who are going through menopause right now. This has been a really great addition to what I do with cannabis. What else do I want to tell you? So I do about 2.5 to 3 milligrams of each throughout the day, as well as 10 milligrams of each in the evening. I also use a CBD-rich extract, full of plant extract that I do not make myself. I do order that one, and I put that in my smoothie, about 30 milligrams in the morning. And something I want to make sure I mention, because this is, so since I've been using Zoladex and anastrozole as part of my maintenance treatment after breast cancer, I have always been using cannabis, but this past week I've taken a break. So what I've noticed is really, really intense pain. If I had to do this for 5 years, I don't think I could, to be honest. And so when I hear people who are complaining to me about the pain from their medications, in particular, tamoxifen is a good example, anastrozole, Zoladex, those are really common breast cancer medications, and it's a very good possibility that you may find some relief from incorporating some amount of cannabis, being aware of drug interactions into your protocol. You may find, I have found, a significant amount of relief. So that's an option for you as well. As always, full extract is always the best. I'm going to do my very next video is all around why full extract oil versus CO2 extracted oil. So we will talk about that next. If you have any questions, you can comment below and I will try my best to get to you. If you'd like clarity on anything that I've mentioned, or if you're looking to for a recipe for that salve, for example, I can post that. Just let me know in the comments, and I hope you have a really great day. Okay, bye-bye.